Okay, well, thank you to everyone for attending today. We're really excited to start our webinar series for this academic year. My name's Steph. I'm one of the CSP student coordinators, and I'm very pleased to have three fabulous speakers for today. But I'll now pass over to our speakers and they can take it from here. Thank you.
Thank you, Steph. Good evening, everyone. I hope you can hear me okay. My name's Khalid Maidan. I'm one of the co-directors from Clinical Physio, and it's an absolute pleasure to be here. So thank you so much to Steph and the rest of the team at the CSP for inviting me to speak today. It's important for me to offer the opportunity for our other speakers this evening to say hello. So perhaps if I first offer Bex to say hello to everyone.
Hi everyone, I'm Bex Francis. I'm the Quality, Diversity and Belonging Officer for the SRG this year, and I'm in my second year MSc at Edinburgh Napier. We're just out on placement at the minute, so we're hoping to bring a lot of the knowledge that we've recently had to you this evening as well. I'll pass on to Annabel.
Yeah, and I'm Annabel, and I am the Wales officer for this year's Student Reference Group. And I am in my third and final year of the BSc at Cardiff University, and I've literally just come off placement. So yeah, some more tips coming your way.
Superb. Thank you so much, Bex and Annabel. In that case, let me share my screen with you all, and then we can get going. All right, so I hope you can all see my screen. Annabel or Bex, could you just give me a thumbs up to confirm you can see the PowerPoint slides?
Yeah, I can see it.
Perfect. Thank you very much indeed. Right. So as I said, it's an absolute pleasure to be here. Thank you so much to everyone for having me. I'm going to be talking to you tonight all about placements. I don't know whether people are on the chat here as first year students, second year students, third year students. Hopefully there's something in here for all of you. I'll do a very quick introduction about me before I go any further. So, as I said, my name's Khalid Maidan. I'm an MSK specialist physiotherapist. I qualified from the University of East Anglia way back in 2008. Can you believe it? It's been 13 years. I can't believe I'm saying that. But one thing I will say is I absolutely remember my student placements because they were a very important time in my life as a student physiotherapist, and I learned so much from them leading into being a qualified physiotherapist. One thing I will say, as I said, I'm an MSK specialist physiotherapist, but when I first did my MSK specialist, my MSK placement, my supervisor said to me, I'm not sure you're quite for MSK. You'll probably end up in respiratory or something like that. To which I thought, oh my goodness, what have I done? And then I did my respiratory placement and I didn't do so well with that placement. So what I'm hoping to show you out of that is that even if you don't have the most fabulous, amazing experiences on placement, don't worry. There's so much ahead of you and so much you can do throughout your career as a physiotherapist. But let's get started. So all about placements. As a member of the Clinical Physio team, we speak to loads and loads of students. So if you're not familiar with Clinical Physio, we're a little organization who do and run education for students and junior physios. And we very commonly have students coming to speak to us asking for advice about placements. And therefore, I hope that I can use this opportunity tonight to give you all the best tips that I can about how you can make the most out of your placements. So tonight, I'm going to be taking you through what to expect for your placements, how to prepare for them, how to make the most out of them, key things to remember to perhaps reassure you, and available resources that you could use to help your learning and again, to help you get the best out of your placements. So first of all, what to expect on your placements. So I suppose the first thing to think about is how long are your placements going to be? This varies from university to university. It also varies what level of student you are, whether you're a year one, a year two, or a year three. You might find that placements are anywhere in the range between 1 week, perhaps if you're in the first year and you're doing an observational placement. I remember doing one in my first year, which was just a week long, just to try and show me what a clinical environment was about. And my longest placement was 8 weeks, but I'm sure that there are others in the chat who may have 4 weeks, 6 weeks, or 10-week placements even. So it completely varies what level you're at and what university you're at. But nevertheless, it gives you plenty of opportunity to get yourself wrapped in that placement. What subjects might you be doing? There are a huge variety of things that you could be doing as core subjects, including musculoskeletal, respiratory, neurology, orthopedics, care of the elderly, perhaps even pediatrics, working with children. But I think it's also important to say that there have been experiences, particularly in recent times linked to COVID, where students don't always get all of the main placement experiences as opportunities. And if that's the case, that's okay. There are plenty of students that I've spoken to who didn't have a respiratory placement, but have still succeeded in respiratory following university. I think it's also really important to say that there are lots of new and exciting placements that you might have, which weren't around when I was younger. So, for example, there are telehealth placements. I know students who have had a telehealth placement where they are effectively at home during their placement, but they're working with a supervisor who might also be at their own house, where they're doing video and telephone calls in order to treat their patients over the phone, because of course telehealth is a major part of physiotherapy now, especially after COVID-19. And also another fantastic placement is an opportunity to do a placement within the CSP, the Chartered Society of Physiotherapy. And I know that the CSP have recently had students on placement who have got involved in different projects within the CSP, and they've really, really enjoyed it. And whilst it may not be traditional physiotherapy, it's still a fantastic chance to see what the world of work is like if you're working in a physiotherapy context, but not necessarily a clinical context. I certainly would have loved to have done a placement within the CSP when I was doing my student time. So how much will you be doing on placement? Well, that can really vary again based on whether you're a first year, a second year, or third year. So I suppose the kind of things that you might ask here is, am I going to be seeing patients by myself? Am I going to be managing a ward by myself? Am I going to be responsible for going out and about as a community physio by myself? I would imagine that the majority of the time, there should always be a supervisor on hand to be with you. I certainly wouldn't imagine that as a student, you're going out to either a community patient home or even being on a ward with no support there at all. But it might be that in your first year, you are constantly with a supervisor who's giving you advice and working with you as you go. It might be that in your final year, you might be left to do a little bit more of the management of a ward or patients by yourself. And it might well be that, for example, if you're in a musculoskeletal setting, you might be in a cubicle with the patient by yourself with no supervisor there. But that's okay. Again, it's a great opportunity, depending on what level you are, to really get stuck into all that the placement has to offer. So assignments and grades. Sometimes if you're on placement, it might be suggested that you do an assignment as part of that placement. So for example, it might be that you have an end of placement presentation to do, perhaps a PowerPoint on a particular topic that you might do to some of the team. It might be that you have an assignment for your university study linked to placement. So for example, I remember when we had to complete an assignment on a particular treatment modality that we practiced on placement, and we had to take our experience from the placement using a case study with that particular modality and apply it to that assignment. So you might find that that's something you are expected to do on placement. And then naturally, the other part of things is grades. And of course, every university and every course will vary differently in terms of the grading system for that placement. Some placements might be pass-fail. Some placements might be an actual grading of a third, 2-2, 2-1, or a first. And again, it completely varies. But the idea being is that try and go into that placement knowing what your grading system is and the different things that you might aim to do in order to achieve the grade that you want. But I think it's also really important for me to say, with hand on heart experience personally, that if you don't always get a first on every placement, please don't worry. I certainly didn't when I was a student. And I think a lot of supervisors on placements are realizing that placements are just as much about learning as it is the grade that you get at the end of it. So there's a good understanding there with regards to grades. One thing that I think is really important to mention is that sometimes being a student on placement means that you are a vital member of the team. It might be that, especially in the current climate within the NHS, that teams may be short-staffed, and therefore you being there is actually a real bonus to the team. Not just the fact that you're there as a second pair of hands, but actually you could really add to the team. So as a result, be ready to be involved in the team quite heavily and be prepared to being able to see patients by yourself at times, because that could be really valuable. Of course, there will be supervisors on hand to support you through that process, but it might be that your learning is not always the priority. What I mean by that is that there might be days when you think, oh, I could really do with some teaching today on this, but actually it might be that seeing the patients for that caseload is the higher priority, and there may not be as much time that day for you to focus on learning. And again, that's okay, because it gives you great experience of managing a caseload and working within a caseload, whether you are in a team or working individually in an MSK department, for example. And then finally on this slide, as a student, you are there to learn, but you are also there to practice. And so what I mean by that, let's say if we're taking a musculoskeletal environment, yes, one could suggest that by constantly watching other physiotherapists do the work, you get to learn and you get to see what they do. And I'm sure there'll be plenty of that on placement. But part of placement is also getting stuck in and doing it yourself, learning how to do a subjective assessment, learning how to do an objective assessment, learning what it means to go to an MDT meeting, learning what it means to be the chief physiotherapy voice at that MDT meeting. All of those things are just as important as actually what goes into your brain and what you learn from that placement. So again, be prepared to do things as a part of that placement. Sorry, I should mention at this stage that I can see that there's some questions in the chat. If you do have any particular questions, please do stick them in the Q&A that hopefully you can see on the panel for the webinar, and I will absolutely get to them as we go through. Okay, so next, how to prepare. So I absolutely recommend that you get in touch with your placement supervisor before you start that placement. And I suppose that's something that is perhaps seen as a good gesture, but it's not only that, it's really important part of the preparation process. So you could either email them or call your supervisor. Don't be disheartened if you try to call and you're not able to get through, or you keep getting the message that your supervisor is busy. It's not that they don't want to speak to you. It might just be that they are really, really busy. I suppose I would always encourage you to try and phone call beforehand to start with, because that's the best way of communicating and getting information across. But if you can't, email is fine. It still shows a willingness on your part to learn what you need to do in order to prepare for that placement. And then some of the key things that you might be trying to discuss with your supervisor beforehand is, what kind of patients do you see? What kind of conditions do you see? If you're working on a surgical ward, what kind of surgeries might I be seeing? Anything that you would like me to look at or prepare in particular before the placement. So it might be that you're working on, let's say, an elective orthopedic ward, and your supervisor says, yes, actually, the majority of our caseload is total hip and total knee replacements. So you would do well to prepare by looking at information on those subjects before you do your placement. And again, this is a vital part of the preparation process more than anything, so that you can show your willingness to communicate with your new team. And second of all, so that you feel confident going on to your first day, knowing that you know what you're about to get into, rather than turning up on the first day thinking, crikey, I've got absolutely no idea what I'm about to do for the next 4 weeks. So I would absolutely always recommend that you get in touch. Secondly, a tip I always give people, and students in particular going out on placement, is learn your assessment order. So what I mean by that is, whether you're going to do a musculoskeletal placement, a respiratory placement, a neurology placement, an orthopedics placement, whatever you're going to be on, try and learn a relative order for your subjective assessment and your objective assessment. So I'm musculoskeletal by background. So by subjective assessment, that might mean my order is looking at past medical history, drug history, and social history, followed by history of present condition, followed by the body chart and all the symptoms, followed by aggravating and easing factors, followed by 24-hour pattern, followed by special questions, etc., etc., etc. And the reason that's so important is because it means that when you are actually on placement, you've practiced exactly what you're going to ask when you have a patient, and you've practiced the order of what tests you're going to do when you have a patient, so that it allows you to retain your brain power for what the patient is saying to you or what you're actually seeing and looking at, rather than thinking, oh goodness, what do I ask next? Oh goodness, what test should I be doing next? So I hope that makes sense. But I suppose the idea is, again, it reserves brain power for what's more important, listening to what the patient says, rather than thinking, what am I supposed to do next? That's always a top tip I give people. Plan and practice your route in terms of your journey to that placement. Now, when I was a student, I did lots of placements where I stayed at hospital accommodation at the hospital, and that journey was quite easy. It was a 5-minute walk. But it might be that you're traveling by car to placement each time, or it might be that you're getting the train each time. And so as a result, I like to try and do that journey at least once before I did my placement, so that on my first day, I wasn't panicking thinking, oh goodness, where do I go now? And that might include actually getting to the hospital, parking up, and thinking, right, now I need to find the physio department so that I know where to go. And again, it's all part of that process to make sure that on your first day, you don't end up in a panic thinking, where on earth am I supposed to be? Plan some potential goals. So it might well be that as a part of your placement, you establish some goals or some objectives that you want to achieve by the end of your placement. Now, the reason I say some potential goals is because you won't always know exactly what's available until you get there. So for example, let's say you're on a respiratory placement, you might have goals of going and visiting ITU and spending time on ITU, or the intensive care unit. However, you may not know whether that's possible or not until you've got there and until you've had a week to see what's available. So it might be a potential goal. And the idea, of course, is that if you can meet with your supervisor towards the beginning of your placement, having some good ideas of the goals that you might want to achieve, that can be really good for demonstrating to your supervisor that you're prepared and that you've really thought about what you want to achieve during that placement. And then, of course, naturally, check out some resources. Now, it might be that your supervisor says, actually, a really good resource that some of our staff members use is this. Or you might have spoken to some of your colleagues who have been on that placement before, and they might say, I've really benefited from doing this. I'm going to lead on to some resources later, but I suppose the point is that checking some things out beforehand is really going to set you up for having some of the key bits of information and knowledge you need to do that placement. Okay, how to make the most of them. So what are the key things for you to do to make sure that your placement is successful in terms of what you attain or achieve or get from it? First of all, talk to your supervisor about good and bad. Having spoken to students in the past, it's natural and understandable that perhaps there's a little bit of a scared feeling towards your supervisor, where you're thinking, oh, I don't really know if I should talk to them. I don't really know if I should tell them that I'm struggling. Maybe if I tell them that I'm struggling, they might mark my grade down. But that's certainly not the case. Your supervisors understand that placement is a challenge. They've been through it themselves. And so as a result, if there are things that you're finding difficult on placement, don't be afraid to talk to your supervisor about it. If there are things that are going really well that you want to do more of, great. Again, talk to your supervisor about it. Don't be afraid to have an open communication relationship with them so that you can discuss all those important things. And particularly if you find that things aren't going well, because if there is a challenge that you're facing, keeping it to yourself makes it more difficult for you to turn that challenge into a solution. Whereas if you talk to your supervisor about it, it might be that they have some really good advice for you, or they might say, okay, I understand what you were saying, that you have a challenge when you're doing your respiratory assessment. Let's try and plan some teachings around that. Or why don't I take the next patient and show you my respiratory assessment so that it can help you? But those things can only come out of the woodwork if you communicate them. So don't be afraid to, either on a weekly basis or a fortnightly basis, to have a really good chat with your supervisor and saying, these are the things I'm finding difficult. Do you think there's any way we can work on these? Next, make notes. And I suppose it goes without saying that you probably were going to make notes whilst you're on placement, but what notes are you going to make? Ultimately, you're finding things that you're trying to learn. So it might be that you're thinking about making notes about specific patients that you worked with. What did you assess? What did you treat? What reasons did you treat things in the way that you did? Maybe it's individual conditions. So for example, again, with a musculoskeletal head-on, let's say you had a patient who had an Achilles tendinopathy. What exercises did you do for that condition? Why did you do those things for that condition? And then finally, I always found that a good thing to do in the last 5 minutes of the day might be to write down, what are the key things that I've learned today? Again, it just helps summarize everything from your learnings that day rather than making it all jumbled up in your head. And ultimately, of course, the notes that you take are there to help you in the future. I can't tell you how many times I went back to my placement notes before doing practical exams. So for example, before my neurology exam at university, I might have looked at my neurology placement notes because I may have picked up a gem in those notes that may have really helped me in that exam. For example, working with Parkinson's patients, and you think, oh yes, I remember that we had a patient who did this thing called freezing. And I remember that we used counting 1, 2, 1, 2 to help with their walking. And again, picking those things up on placements helps you in the future. The next thing I was going to mention is the level of activity, or perhaps the way you should approach or could approach your placement based on what year you are in your university. So I realize that some of you might be doing a master's degree where you only have 2 years. Some of you might be studying in Scotland where you have 4 years. If I could, if you don't mind me summarizing in terms of a 3-year degree, it might be that in your first year placements, you're focusing on learning and trying to get as much information as possible. In your second year, it might be that you're trying to prioritize consolidating your learning by getting involved in a bit more activity, or making sure, or trying to take the lead from your supervisor in times, perhaps saying, would you mind if I tried to voice my clinical reasoning, or would you mind if I tried to lead the next patient? And then in your third year, and particularly towards the end of your third year, you'll be quite close to qualifying. So it might be that if you have your final placement, let's say in April of 2022, and you're qualifying in July 2022, you might be running that ward yourself by the time you're a junior physio. So as a result, in your third year, you might have the focus of, I'm preparing for work now. I'm preparing as if next year I had to run this ward myself. So again, you might try and take a little bit more ownership over things like MDT meetings. Or if you're working in MSK, you might try and see as many of the patients by yourself without your supervisor directly there, to give you the opportunity to try and voice your opinion without their immediate feedback. Again, just so that you can practice for what it might be when you're out there in the real world, as it were. The next piece of advice I'd give is please, please, please get involved. What I mean by that is try not to be passive whilst you're on placement. Try not to rely on other people to tell you what to do. Try and take as much initiative as you can. And if you don't have much to do, ask, is there anyone else that I can help? Is there any other opportunities I can do? Is there an MDT meeting today that I might be able to sit in? Effectively, your placements are the best clinical opportunity that you'll be able to get to learn as a student. So try and make sure that you really take that opportunity by getting involved, getting your hands dirty and getting stuck in, as it were. And then my final piece of advice on how to make the most of them is make sure you balance your time and get plenty of rest. I did my placements 13 to 15 years ago. However, an undeniable feeling that I absolutely remember from doing those placements is how tired I would be at the end of every day. And the reason for that is because you're just challenging your own mental capacity every day on placement. There's so much you can learn. There's so many new things you can do. There's so much that you can study. And I found that after a day of placement, when I got back to my base or my room or whatever, I would be really tired. And I want to highlight that there's no problem with that. And I in fact wouldn't necessarily advocate that you do a full 8 hours on placement and then spend 6 hours in the evening studying for the next day and doing that every day on the repeat, because it can be exhausting going through that. And that's why it's so important to balance your time of trying to recover and making sure you get adequate rest each day so that you can feel prepared and fresh for the next day. So that might be that in the evenings after your day of placement, you spend maybe 20 minutes or half an hour looking at something you learned that day or looking at something that you might be thinking about the next day. But don't over assault your brain by trying to do so much that you end up absolutely exhausted. Get plenty of rest, get plenty of time to do the things you enjoy on a day-to-day basis, listening to music, going to the gym, speaking to friends, whatever it might be. Make sure you get just as much of that time in so that you can keep your body happy and healthy, as well as doing as much as you can to study. And if you find that you are getting really exhausted on placement, do tell your supervisor. As we said, talk to them about good and bad. It might be that you have a 45-minute drive towards your placement every day. Then you have your 8 hours of placement, and you have 45 minutes getting home. Then you have to make your dinner, and then you need to go to bed. And if that's the case, and if you're really, really struggling, again, tell your supervisor. They understand. They've been there before and they've done it. And so don't be afraid to have that conversation so that you can feel better about the situation. Okay, so some ideas on some things to remember. First of all, your supervisor is not out to get you. What I mean by that is, I certainly remember being a student thinking that my supervisors were constantly trying to test me and they were constantly trying to catch me out. But that's certainly not the case. Your supervisors on placement may well ask questions to check if you know something, or ask questions because it might be that it's a really good learning style by answering questions and having to process that in your head. But it doesn't mean that they're trying to catch you out. It doesn't mean that they're trying to find the ways to fail you. Far from it. It might be that it's the way that they feel they can offer you help best in order to help your learning. And if you find that there's a particular way that you learn best, whether it be that you learn by doing and you learn by actively doing the work yourself, whether it be doing that patient assessment or trying that treatment technique, then say that. If you learn better by writing things down, then do that. And you can ask your supervisor perhaps to set you 3 questions that you can go away from that day and write out some answers to because you learn better by writing. Whatever it might be, again, don't be afraid to have that open discussion with your supervisor. They're not out to get you. And of course, feedback is a really important part of placement. It might be that your supervisor at times may say to you that you didn't do so well on something, or that you might need to do something differently. And the advice I'm trying to give you here is, don't be afraid to embrace feedback. Your supervisor has to tell you somehow if they have to communicate that something needs to be done differently. That's not a reflection that you're a failure. That's not a reflection that you don't know what you're doing. It might just be that they have to tell you. So don't worry if some days you hear really good things and some days you hear a couple of not so good things. That's okay. You're learning. You're a student. You're not going to get it right each time. I suppose the idea here is, don't get too unconfident if you hear your supervisor having to have a chat with you along those lines. As I said, I didn't do very well in my respiratory placement, or I suppose I would probably consider it to be my worst placement as a student. But I needed to hear that information. The honest answer was, I didn't do very well. I didn't throw myself into the placement as much as I should have done. And the feedback I got wasn't as good, but again, it helped me, because when I was a band 5 going into my respiratory rotation, I made sure that there was things I learned, and I made sure that there was things I did off the back of my placement, which really helped me. So even if it seems like a negative at the time, it absolutely will be a positive later on. There's always a balance between trying to learn as much as you can on placement and impressing. What I mean by that is that naturally, in order for you to demonstrate your abilities, and in order for you to demonstrate your grade, or for you to be able to demonstrate that you understand something, there's going to have to be an element of doing, i.e. learning doesn't necessarily demonstrate that you understand the situation or the subject. So what I mean by that is, take plenty of opportunity to show your supervisors that you know how to do something. So if your supervisor says to you, do you think you'd like to try and take the next patient? Don't be afraid to say yes. If your supervisor says, would you like to lead the subjective assessment for this patient next? Don't be afraid to say yes, because in order for you to demonstrate to them that you know what you're doing, or that you've understood what you need to do, you're going to have to impress by doing it. A couple of really simple things that can make a big difference. And I think the reason that these things are really important is twofold. Number one, to show that you care during your placement and to show that you're willing to put the effort in, but also for your own confidence and to relieve the pressure on you. So some of the things I've mentioned here is turn up on time, look professional, be prepared, make the effort, and try to integrate within the team. Try and get to learn their names. Try and get to learn which wards they work on, for example. Now let's flip that on its head. What if you turned up late? What if you weren't looking professional and your supervisor had to say, could you tuck your shirt in, please? Those things put pressure on you. I have to admit, I remember being late to a placement one day and it didn't go down very well. And that just put extra pressure on me to have to work hard for the rest of the placement to show that I was trying to be professional and that I was prepared to turn up on time. So all of these things take the pressure off you, as well as demonstrate that you care and that you are passionate about the placement that you're going to be on. So I hope that makes sense. A couple of simple steps can make a really big difference. So COVID-19, it's obviously a really tough time for students. And we know that throughout the pandemic that it's been challenging for so many reasons. But I also have to say that it's going to be challenging for those in the hospital environment as well. To give you a bit of an idea, working in an NHS environment during the pandemic, as I have done, there are people working on wards that they weren't prepared to do, or that they are not used to. I was working in a musculoskeletal environment, but I found myself on the intensive care unit treating COVID patients. It might be that your team have members of staff who are off sick because of COVID, and that means that they are short-staffed that day. It might be that services have changed because of COVID. I was working in a musculoskeletal environment during COVID, and our gym in that hospital had to be converted into a discharge lounge. So it was really difficult for us because we didn't have as much space to treat our patients. What I mean by all this is that your supervisor will realize that COVID-19 is stressful for you, and it might be stressful seeing COVID patients. But remember also that it could be stressful for your supervisor and it could be stressful for your team. No one's trying to make things more difficult for you because of COVID if you have to run around different wards all the time. If there's days where you have to stay a bit late, for example. Again, no one's punishing you because of that. It might just be the situation because of COVID. So if that's the case, remember that you're not the only one. It's likely that the team and your educators might also be under stress as well. It might be that they're trying as much as they possibly can to teach you as much as they can as a student, whilst managing their own ward where they've got to discharge 5 patients that day, and the assistant that normally works there is off sick due to COVID. Be mindful. It's not the easiest environment for anyone at the moment, but I know that your supervisor will try and give you as much experience as they can whilst you are working with them. And then the final thing to say in terms of things to remember, enjoy it as much as you can. I know I may have painted that it is hard and you might well feel tired at the end of each day. That's normal. I can promise you that I've been there and worn the t-shirt. But at the same time, I learned so much on placement as a student, and so much that really helped me for my clinical practice in the future, for my exams, for my written assignments, and generally, my experiences on placement also made me more passionate about physiotherapy as a whole. And as I said, I have had difficult experiences on placement as well, but I can speak to you today as a MSK specialist physiotherapist, telling you that if you do have tough times on placement, it's okay. I got through them, and thankfully I'm in a place where I'm happy with what I've been able to do within physiotherapy, and I'm sure it will be the same for you as well. So if things don't go so well, don't worry, there's plenty of opportunity for you. So next, I'm going to mention a couple of resources that might be useful for you for learning for your placements. So here at Clinical Physio, as I said, we do education for students and junior physiotherapists in particular on all the different topics under the sun. You can find our website at www.clinicalphysio.com, or you can find us on Instagram at Clinical Physio. Some of the things that we can offer include over 100 free MSK assessment videos, which are on our website. So for example, we go through the cervical spine, observation, palpation, active range of movement, passive range of movement, resisted tests, and the same for the shoulder, the knee, the hip, the lumbar spine, the ankle, you name it. So all of those videos are available on our website. And also we have a series of webinars or handbooks of notes also that can help you in a variety of different subjects depending on what placement you're on. So it might be neurological assessment or respiratory assessment if you're on one of those placements. It might be ABGs, it might be chest x-rays, it might be differential diagnosis of the shoulder, of the knee, of the wrist and elbow. It could be that you're on orthopedics and you want to learn about total hip replacements and total knee replacements or lumbar spine surgeries. We've got lots of those different webinars that can help you. And once again, you can find them all at www.clinicalphysio.com. But it's also really important for me to say that there are lots of other resources out there that can be incredibly helpful. In particular, it's important that I highlight the ones that are available through the CSP, the Chartered Society of Physiotherapy. You might be aware that the CSP has lots of individual specialist professional networks, and you can find details of that at www.csp.org.uk/professional networks. And for example, I've got here that the Association of Pediatric Chartered Physiotherapists have some fantastic resources for students who are on pediatric placements. The other thing I would really suggest you do is get involved within your physiotherapy societies. So whatever university you're at, ask the different students around you about the Physio Society at that university, because they might also run some fantastic talks during the year that can help you. They might have guest speakers who do talks online, just as we are doing tonight. And also, of course, please keep your eye on the CSP Students account, because as Steph said at the beginning, they're launching their webinar series for the year, and they are absolutely fantastic resources that can also really, really help you during the year. So there is plenty out there that you can use in order to try and help you. And I suppose the final thing for me to say is be inspired by being on placements, enjoy it, but also be kind to yourself. Do remember that coming from me, it can be a tiring experience. So be kind to yourself when you're on placement. Remember that you don't have to learn absolutely everything. You don't have to come home every day and read for the next 4 hours before you go to sleep. There are loads and loads of things that you can do during your placement, but then also make sure you have time to rest in the evening. But yeah, more than anything, it's such a great opportunity to learn. And of course, if you have any questions at all, of course, put them on the chat and I'll happily try and answer them. But also, again, you can find us on Instagram at Clinical Physio, or send us an email, info@clinicalphysio.com, and we'd be absolutely delighted to try and help you. Now, I was just going to say that I can see that there's some questions in the chat. I can see that Annabelle has answered one already on the physiotherapy pocketbook. Howard was asking, is having the book okay during my placement? I completely agree with Annabelle. It's a great idea to bring with you, and you are certainly allowed to check things day to day. I suppose the advice I would give you, probably like Annabelle has said, is leave it somewhere where it's not visibly on show all the time, only because the fact that if you're sitting there in front of your patient reading through what you're supposed to be doing with them, it might be a bit challenging. But of course, it might be that if it's somewhere easy for you to access, of course, go to a desk somewhere, or go to somewhere quiet on the ward and just spend a couple of minutes checking something. Of course, absolutely, you're allowed to do that. I can see that there's a couple of questions that Annabelle has said she's going to answer, so I'll definitely leave that to her in a second. But I can see some other ones that, ladies, would you mind if I tried to answer some of these that are on the screen other than
Go
what
for
you've...
it.
Thank you.
Cool. You're probably best off answering some of the other ones.
I'll try. Okay, so I'll look at the ones that Annabelle hasn't highlighted. So do different fields have different assessment orders? Do respiratory, MSK all have similar subjective assessment templates? Good question. Ultimately, I would probably consider that they have different templates there or thereabouts. First of all, every musculoskeletal department you go to will probably ask similar questions, but in different ways. So in some departments, you might ask the patient all about their past medical history, social history, and drug history first. Whereas in other departments, their paperwork means that you ask about the history of presenting condition first. Some of them might ask special questions at the end. Some of them might ask special questions halfway through. So you might certainly find that hospital to hospital, there might be differences. But otherwise, yes, I do completely agree with you. Different fields will have different templates. So for example, if I was to compare for a minute respiratory versus neurology. In respiratory, you might ask a lot more about a patient's chest symptoms, their breathing, their coughing, and their general mobility. Now, within neurology, all those things are still important because as a part of their neurological condition, they could have respiratory issues, but you might well focus on more individual neurological things within your neurology assessment, such as hand dexterity, coordination, tone, power, which you may not always go into as much detail in the respiratory world. So again, I hope that answers your question that yes, there will be differences between the assessments between different subjects. And again, if there are, as I said, we have resources that kind of go through those differences if you so want to look at them. If you need any help with that, as I said, please give us a shout. Nicola, Hi, Nicola, by the way. I've spoken to Nicola a couple of times in the last few days. When thinking about assessment order, is that thinking of it in SOAP format? Yes and no. So if you're thinking, if I mention for a second in the musculoskeletal world, because that's kind of my world, if you will, you will certainly have an order. In the MSK world, you might find that when you go on placement, they have paperwork that is already laid out for you, which says past medical history, drug history, social history, history of present condition, aggravating and easing factors. And in which case, you might find that you prefer to do it in the order that the paperwork is in, but you might be on placements where you don't have that. So, for example, on a respiratory ward, it's unlikely that you're going to have paperwork planned out that goes through looking at the speaking to the MDT about the patient, looking at the medical notes. What are the observations? What are the bedside observations? What's the patient? So the idea being is that the SOAP notes may not always follow the exact format of that. But also, I can see from your question that you're asking, is the assessment order also the order that you do your SOAP notes? And yes, absolutely, you can do it that way if you learn best that way. Especially if you learn a specific order, and that means that you remember all the things that you need to write down. So for example, let's go back to respiratory, and let's say that the order for your subjective assessment might be: speak to the nursing staff about the patient situation, check the medical notes to see if there's anything there, then look at the bedside observations, then ask the patient about the history of presenting condition. If that order of your assessment also helps you write your notes because you know the order you're following in the notes, great. I hope that answers your question. But if not, Nicola, you know where to find me. Give me a shout. Inella, can we build our CPD from the university? Yeah, absolutely. There's loads that you can take from your placements that you could use as CPD. So particularly on placement, there's certainly a lot of reflections that you can do. I'm sure that, for example, taking some of the notes from a patient case study that you may have done could be really, really useful for reflecting on it later on. Or, for example, it might be that you reflect on, today I did my first assessment on the neurology ward. This is how it went. This is what I learned. That's fantastic CPD because you're reflecting on your experiences. So yes, absolutely. Cool. I think those are the majority of the questions that don't have an Annabel or a Bex next to them. Ladies, perhaps I should hand over to you now so that you could answer some of the questions that you wanted to answer. Shall I go for Annabel first?
Yeah, we'll do that.
Cool. I'll be here in the background if you need anything.
Amazing. So before we answer some more questions, Bex and I are going to give you some top tips on what we find really useful to carry on with this whilst we're on placement. So I'm going to start with the first thing, and that is the name badge. One, it tells other people who your name is, but also informs them that you're a student, which is also quite good at some points, because they'll start asking you questions for certain things because they realise that you're a student and might not have all the answers. So that's my first thing. Bex, what's your next?
So I would say for me, a notebook. This one is a little mini A6 version. It's hardback. And this one, I think I got it for like 60 pence or something in Home Bargains, would you believe? But it literally is a perfect size to fit in your scrubs pocket or in your trouser pocket if you're wearing a polo shirt. And it's just like one of them really easy things to have with you that if you need to take notes, then yeah, you have it there just to take notes or note down anything that you're not sure about to then come back to later, things like that. But definitely a little mini notebook is one of the main things to have with you.
I go for a slightly smaller one, which is also provided by the CSP at some point, that sits in my back pocket because it's the perfect size. So yeah, my next two things is actually 2 pens, because you never know when one's going to run out, but also you never know when a clinical educator or another member of staff is going to sneakily decide that it's theirs.
So many times.
Yeah, so take 2 is my next thing.
Yeah, I'm going to follow up with that as well. I have one that's like all different colours, because obviously we need black pen to write soap notes. But sometimes, again, if you want, for prioritising, if you're on a ward, for example, and you've got a lot of different patients to see that day, you might want to kind of prioritise, have different colours for that. Something, it's just for your notes. If you want to highlight something, to go back to it to look up, if you don't know what an abbreviation means, or a medical condition that you've not heard about, or you want to go back to it later. So I have one that's like black, green, blue, and red, and then you can just kind of like have different colors as and when you need it. And on that note as well, a highlighter, because again, sometimes if you've got a whole list of patients, you're not going to see all of them. Some of them might be discharged by you already, so you might just want to go through and highlight the ones you're going to see that morning or that day. So that actually really helps too, is having a highlighter pen.
A new addition for this placement that I was actually told, the trick was given to you by my physiotech. So remember, physiotechs are just as important as your clinical educators, 100%, is a tape measure.
Yeah, one of them too.
Used it twice on this last placement, because you never know when you need to measure somebody up for a stick or whatever, and you don't have that facility with you. So you can quickly measure them up whilst you're there, and then you'll have the measurement ready for when you need to go back to your educator and go, can we order X, Y, and Z, and their measurements are X, Y, and Z. And it's one way to sort of quickly impress a member of staff.
Definitely. And I'll follow up again by saying that I've done a bit of leg length measuring on my ortho placement at the minute. And also, like, one of these kind of tape measures is better than the ones where you press the button and it zips in, purely because they tend to break all the time. So one of these, corner shop 99p or something like that, is perfect. I'm going to jump in with the next one, which is a whiteboard pen. So as I'm on ward in an acute setting at the minute, I'm doing orthopedic trauma, absolutely loving it, having a great time. And you have to update the patient's mobility status on their individual room whiteboard. So a board pen is actually really good. I actually got given this one by the hospital. It's now mine. So yeah, take a board pen with you, or get one if you know you're going to need to update their kind of weight bearing status or their mobility status as well.
And depending on what placement you're on, having a stethoscope is quite useful. Sometimes you can find them on the wards, but it is quite nice to have your own ones, because obviously you're sticking them in your ear, so bodily fluid, So yeah, that is what we keep in our pockets.
I've got a couple of extras, purely because I'm on an MSK placement, kind of ortho trauma at the minute, and that is a goniometer. Okay, so goniometer has been really good for particularly like day one post-op kind of hip replacements, knee replacements, things like that, is to finding out when you do your first set of notes, and then obviously go in how much range of motion someone's got. And the other one is scissors. Now, I never thought as a physio I would need scissors actually, but scissors have actually used, because when you're putting on people's like a moon boot, for example, or a camp splint, you're actually then, the straps are made too long, because obviously everyone's legs are different widths, different circumferences. So you always have to trim the excess. So, or taking dresses off of someone when you're trying to fit a splint, if they've just had surgery as well, is actually a really good one. So yeah, scissors. Again, the board gave me these. So yeah. And yeah, that's kind of what's in our pockets, really. And again, just following up with the question about the physiotherapy pocketbook, one of the many benefits of joining the CSP as a student member, and like Annabel and Khalid said, have it somewhere. Like, I often have this with me where I can go, and then like on break time or something, if I'm like, oh, I wanted to know what that was, just have a quick look through it, and it's actually been a really, really useful resource for placement. So definitely would recommend this one as well. Should we get on to some of the questions? Do you want to go on to the ones you do one, I do one?
So none of these questions are silly. And uniform and placement. Generally, it's quite bog standard. So it does vary between university to university, and occasionally placement to placement. But for Cardiff, it's generally our white polo shirts, blue trousers, and a pair of black trainers. but I know there are some settings that it could be something professional wearing. So yeah, but also Cardiff very kindly has pre-placement information on each placement, and your clinical educator also has a bit on here for uniform. So generally you travel in your own kit, own civvies, and then you get changed before you start the day and then before you leave for hygiene.
We have the option, again, up here, depends NHS trust to NHS trust. We have the option, we get supplied with like blue polo shirts from the uni, and then we have like our scrubs as well. So yeah, you have the option of both, but it depends. The one I'm in at the minute, we have to wear scrubs rather than polo shirts. More outpatients when I was on last time, you could wear either, they didn't mind, with tracky bottoms. But on at the minute, we're wearing NHS blue bottoms, which kind of look like cargo pants, and then our scrubs on the top as well. And just a little note for cargo pants, sometimes it's better to size up, because you want to be able to move in your cargo pants rather than getting a small and then you can't bend down because they're actually quite tight. So actually it's sometimes better to size up one and then sew your legs up, because they always make them really long. So you have to chop the bottoms off as well when you're doing that.
The next question that I said I was going to answer was asking if placement is kind of like a job and also a learning space. Yeah, see it as a bit of a job, but it's a learning experience, if that makes sense. So go in there, as Khalid was saying, just be proactive, be enthusiastic, and just be willing to get stuck in. And if you have any questions, ask the questions at the appropriate time. And I think that's the best way to get out of it and show your educator that you're actually willing to, get in there. And you'll quite often score quite highly.
We had this week, like last week on my placement, I actually kind of felt that I was more like a new band 5 than a student. For the first time ever, I actually was like, oh, this actually feels like I'm kind of doing a job right. I'm doing something right. And yeah, it felt really good, like to kind of get your time management right and be able to write your notes up and not be sitting there at the end of the day, still doing them. So it is kind of like a job, and you do learn a lot of job skills on your placement as well. So it's go in there and enjoy it, I would say, is definitely like the best thing as well, is really try and enjoy it.
Before we follow on, somebody just asked what are the usual working hours. It really depends placement to placement. I've done like 8:30 to 4:30 is quite common, but 9 till 5, 8 till 4, it really depends on what service you're in, which dictates what hours you do. But you generally stick to the hours that your clinical educator does. Yeah,
you do. And their days off too. So if it's a bank holiday and they're off, you're probably going to be off as well. They might, if they're off on holiday, they'll assign you someone else to shadow normally. So if they're off, don't panic that they're off, just they will organize that for you, who's going to be your kind of what you call it,
go-to person.
Go-to person for that. And then on that back of that question as well, there's one from Naomi saying, what is the ratio of hours spent on off placement? Again, everyone is different. Some will be a 37-hour week. Some will give you afternoon off for kind of like reflective practice, or a day off for reflective practice or assessment, like assignment work. If you are doing like a presentation or something like that as well. So again, everywhere's kind of different with that. If you are doing project work and are expected to do that, a lot of placements will give you that time to do that, because they don't want to run you into the ground. I remember my first MSK one last year, and I literally got in at 5 o'clock in the evening and I was like, I'll just have a wee nap, and literally woke up and it was 9 p.m. I was like, oops. So literally you do get really tired. So just, if you are getting tired, just tell your placement educator that. Annabel, did you want to say a bit more about that one as well?
It depends, but make sure you have time for yourself before and afterwards. So I was just on a mental health placement, which was, I had no idea what it's going to be like before, but it's been one of my best placements ever. And because of the type of placement I was on, it was just like the whole 8 hours was constant. And I was discussing with my clinical educator, that you need actually, I know, 20 minutes before or half an hour before, and then the same again in the evening, just for yourself, and just sit there, do nothing, go for a walk or something, and just switch off, because you're constantly worried about patient safety, what you're assessing, the questions that you're being asked by your clinical educator, or questions being asked by other members of the MDT, the other patients that are around you, and their safety in a ward environment. So you've got basically 100 things going in and out of your brain at this one time, and it is tiring, but it's worth it.
Definitely, 100%. And there's a few questions coming in that I think we can answer sort of along the same lines. Do placement occur on the weekend? Yes, they do. If it's something like MSK kind of sports, so you might be at rugby club, football club, things like that, then yes, you do have the opportunity to cover games. You might be working on weekends as well. If it's NHS-based placement, normally it will be Monday to Friday, sort of 9 to 5 hours-ish, around those kind of times. Even if your educators are on call on the weekend, you normally aren't expected to be. But again, everywhere is slightly different. But if it is more of like a sports-based placement and they've got games and things to cover, then yes, you can be doing weekends as well.
Saying that,
you go.
Towards the end of your university or on a placement, if they are doing like a weekend, you by all means can ask to have that week, like shadow and weekend, to see what it's like, and then quite often they will give you sort of like 2 days off during the week just as a compensation.
The swings and roundabouts, definitely, yeah. And again, with things that someone said, is there a possibility of asking for specific days off, or is it what you were given? A lot of the times it is what you're giving, but if you need a day off for a valid reason, I had a day off placement recently where we had our first student reference group meeting down in London, which was an amazing day. And again, because it was physiotherapy focused, again, hours for like, if you want to attend the Physiotherapy UK live conference, things like that, then yes, they will often give you time off for those type of things. And again, they will give you time off for things like doctor's appointments, stuff like that. And again, you can ask for things like if you need a day off because you're going to be, for a wedding or something like that. They are flexible with that, but just often it's a case of communicating with the university and your clinical educator, both of them, to make sure the uni's okay with it and the clinical educator's okay with it. So just having that communication between all three of you is kind of like really important for that.
Bex, do you want to answer the one about additional needs, because
yes,
perfect for that one?
Yeah. So hi Emma, thanks for your question. I have additional needs myself. I have hearing loss, and this is something that I actually want to really focus on promoting this year with universities and educators. Is what is the kind of process for letting your educator know? Now, universities aren't allowed to let your educator know about your additional needs. Okay, that's what I would say. You have to be the one to let your educator know. Try and do that if you can in your pre-placement starting kind of like email or telephone call with your educators. Now I send an email out saying, have a bit of introduction about yourself, what you've done previously, what's your background, what you want to get out of this placement. And I also have a little paragraph in there saying, hi guys, just so you know, I'm pretty deaf. And then what else I come with, which is nice little microphones and funky hearing aids and things like this. And I just put on there as well, here's my phone number. If you want to, if you want to have a chat about this, which I would prefer, if we could have a chat with this before we start, that would be great. But it is the responsibility of the student with additional needs to reach out and tell the educator about those. The university can't do that on your behalf. So yeah, definitely reach out to them as well, because then they've got time to, if you need things put in place, XYZ, whatever that support you need, then they will be able to get that in place for when you start. And I've not met an educator so far that hasn't worked with me and helped me out. COVID does make it a little bit difficult with the mask and lip reading and things like that, but there are ways around things like that as well. So yeah, it's your responsibility to do it, but I've never really had a problem with anyone, making reasonable adjustments when I've needed them for placements. But get in touch and tell people about them is what I would say.
There's a few questions on hair dye and tattoos.
Yes.
And it's really, I think, dependent on the trust, but as long as it sort of looks professional and isn't offensive,
yeah,
you I don't think you can get it wrong. And I suppose it's sort of in line with your university policy as well.
Mm-hmm. Definitely. Piercings as well. Piercings, I have multiple piercings and a nose piercing, and most of the physios that I work with have nose piercings, believe it or not. Seems to be quite popular among physios. It's just a case of, if you're going with the NHS, one pair of plain studs, you probably need to take most of everything else out. All right, so no necklaces, no bracelets, no watches, no Fitbits. And that's one thing I was going to say as well. My Fitbit, I normally fit around my ankle inside my sock. So if you want to keep your step count up for placement, wear long socks and then tuck it around your ankle in your shoe. That's what a lot of people do on placement. But yeah, tattoos, not really, unless, yeah, it's just that it's not offensive, and they don't really mind too much about that. You're not allowed to, often, well, in a lot of settings at the minute, particularly with COVID, you're not actually allowed to wear long sleeves to cover them up either. So a lot of people sort of, if they're coming up to about here, but if you do have things down your wrists, not a lot of people really pay too much attention to them nowadays. You should be fine. And again, hair color, same. I had bright pink hair last year. It wasn't a problem. And yeah, just make it a talking point with the patient sometimes. It can be quite nice.
On that topic, funky socks also is a good talking point with patients, is what I found. A couple of people asked on sort of knowledge. You're not expected to know everything, and Khalid will probably rightly correct me, he doesn't know everything as well. So it's all right to say I don't know, and actually clinical educators love it when you say I don't know, but I'll find out, and then you come back the next morning or the afternoon and go, the question you asked, here's the answer. So yeah, don't feel like you need to know every muscle, ligament, joint capsule, prognosis, the whole, it'll be too overwhelming and you just stress yourself out. So just take little bits at a time. And going on to that, assisting with diagnosis of patient during a placement, yeah, you will be doing that. Might not be first off, but you'll be treating a patient, seeing a patient. So it's what a physiotherapist does. So yeah, you do it. But it is also it's good fun finding the jigsaw puzzle pieces and going, this is what I suspect is the case. So yeah.
Yeah, I think as well with that is, even at the start, although you might not be expected to kind of diagnose the patient, what your clinical educator might say to you is, after you've come out that patient, say, right, clinically reason that for me, what do you think it might be? Or, what are your kind of differential diagnosis? Do you think it's this, or do you think it's this? And what tells you it's more this and this? And I remember my first one, I was just like, oh my God, I'm not sure I know this. But with practice, and that's what it's all about, it's placement, is practicing that. It really does make a difference and build your confidence massively. I just want to touch on the CPD questions that we've got coming in. The CSP on their website actually has a really good CPD kind of write-up, gives you a lot of guidance on it, and you can log your CPD from your online CSP account as well on the website. So if you haven't already signed up for your student account on the Chartered Society of Physiotherapy website, I'm going to do so, because they get a lot. You get a lot of benefits from that and a lot of knowledge on CPD. You have different CPD courses and web pages and things like that, but they also give you a lot of advice on how to write that up and then log it. So if the CSP were to say to you on when and start logging your CPD now, but then when you're qualified, if they say, oh, I want to see your CPD log, you go, there it is, it's on the website, so it's a good practice to get into now as a student, and that was one thing we got told at the start of our MSc was, do it now. Every time you go on a placement or another course or something, write a CPD that you've done, because it all counts towards it.
There's a question on expectations, and I find this is quite useful at the beginning of, we have a meeting at the beginning of our placement, in the middle and the end, and sort of I've discovered actually it's completely professional, like you're both adults and professional, so you just sort of at the beginning lay down what your expectations are of your clinical educator, and they'll do the same of you. So one of my expectations with like clinical educators is just to tell me things that are going well and things that aren't going, or just tell me things I can improve on. Tell me at the moment rather than sort of at my halfway or at my end of placement, because then I can sort of I'll change it for the next patient automatically. So that was one thing that I sort of from my third placement onwards is what I've sort of said to clinical educators.
Definitely, I'd follow this up, say exactly that. Speak to them, like communicate with them, definitely.
Because it's a partnership at the end of the day.
Totally agree. Sorry, ladies, just say I think we've got 2 minutes.
Okay, cool. The last one, any tips you found helpful with managing your coursework dissertation as well as being in placement for a long period of time? Yes, I did that this year. Get started on the dissertation early. No matter if you think, oh, I'll do it then, start earlier. Okay, I'm not even joking. Like, give yourself the most amount of time to get that dissertation in, because what you don't want to do is, if you're then on placement when it's due, it's going to be tough. Okay, so really, really, really start early. I did start fairly early, to be honest, on mine anyway, but I wish I'd started it even a month earlier. And just try and fit little bits in around your placement where you can, is really important, because around family life and work and things like that, it can be quite tough to get some U time in as well. So start early for your dissertation.
And you're not going to be able to put 100% into everything. So you might not be able to get, we were told by our lecturer that in our next level 6, you're going to have to potentially drop some of the evening reading to do a bit of dissertation work, and it's just going to swing around about. So you're not going to be able to put everything in one basket the whole time. So yeah.
Definitely.
Awesome. Thank you so much to Bex and Annabel for those fantastic questions and answers. As students and members of the Student Reference Group, you are a great example of student physiotherapists, and the experience that you've been able to share with everyone tonight clearly demonstrates that. So thank you so much for doing that. I think if Steph doesn't mind, perhaps we can summarize just by saying thank you so much all for joining us. Thank you so much for being part of the CSP Students webinar series tonight. Please make sure that you keep an eye on the future ones that they will be doing. Follow at the CSP Students on Instagram, as there is so much that you can learn from them. If you want more from me and us, once again, at Clinical Physio on Instagram, and I'm sure that you'll find Annabel and Bex on there too.